Since the 2020 declaring of COVID-19 as a pandemic, public health and employee wellness have taken on increased focus in businesses. As the current waves of influenza, RSV, and other infectious diseases continue to keep these topics top of mind, I, your TAG Talks host, Lisa Lupo, am talking with TAG President and CEO, Dr. David Acheson, about the most significant public health related events of 2022 and his expectations for 2023. Good afternoon, David.
Hello, thank you for inviting me to chat with you again.
Yes, it's always good, always interesting. So today, let's talk public health. So from your perspective, what public health issues or infectious diseases of 2022 do you see as having the most impact on businesses?
As we look back at 2022, public health-wise, obviously the year kicked off with continued very high levels of COVID as the Omicron variant was rampaging across North America. This time last year and going into January, we were seeing some of our highest case rates of COVID since the pandemic began. Mm-hmm. Hitting points where just tens of thousands, hundreds of thousands of new cases almost on a daily basis. I think we almost reached 1 million a day at one point at the height. The good news, if there was any, around that was at least that variant, the Omicron variant, was less deadly than some of the earlier ones. As we all know, it kept mutating and going from the original strain into Alpha and Delta and Omicron, and now it's continuing to go down that pathway with multiple variants. So as it was mutating, it was becoming more infectious, more transmissible, but thankfully less deadly. It obviously had continued through 2022, the earlier part of the year, the first quarter at least, a massive impact on people's movement, behaviors, social interactions, absenteeism. A lot of people were sick. A lot of businesses struggled, especially in the early part of the year when so many people were out with COVID. Thankfully, as the year has sort of moved through into Q2 and Q3, the numbers of cases diminished pretty significantly by Q2. Cases were down. A lot of things opened up. Travel opened up. Many of the restrictions disappeared. So life went back more to what it was like before COVID in terms of personal behaviors and travel. But one of the impacts of all of that from a food industry perspective was I think many people who had quit stayed out. I think there was a belief that when COVID went away, the workforce would come back, and it kind of didn't. So food companies have continued to struggle with absenteeism and having enough people on the lines to do the work. We've continued to leverage temporary employees, which in and of itself is a challenge as you get them trained and then they don't stay and so they're gone. Mm-hmm. So, the revolving door phenomena has definitely plagued food industry. And from chatting with folks who are part of large corporations, and sort of question is, when's it going to come back? And the answer that I'm getting is it isn't. Yeah. This change is more permanent. I think lifestyles have changed. I think COVID got a lot of people to sort of reflect a little bit about work-life balance and staying home and not working 7 days a week, etc. One of the companies that we work with made an interesting change. It's a meat company, and they traditionally run 7 days a week, pretty much 365 days a year. COVID changed that because they just didn't have the people. Mm. And based on that, they reduced down to 5 days a week during COVID. And then they made the decision not to go back up to 7. So it's like they're going to run 6 days a week, Sunday's a day off for maintenance and for cleaning and sanitation and the like. And that once every month or so, they're just going to close the plant completely and everybody's going to go have a weekend off.
Oh,
So
wow.
they kind of adjusted. Um, and interestingly, the morale's has improved. Productivity during the days they're working has gone up. Um, so it's sort of just interesting ways that companies have adapted to the societal changes that COVID created. Um, Larger corporations are looking at this as a challenge and exploring how can we automate systems
Mm.
more? How can we manage with less people because we're going to have to? Um, so that's sort of the way the year evolved with COVID. Now we went through Q2 and Q3 with COVID going down, and everybody, I think, a little anxious about what's going to happen in Q4. And we're now in that period. We're in the middle of winter. Um, are we going to, did we get the anticipated massive surge that some people worried about? Short answer is no, we didn't.
Okay.
Um, we've got an uptick in cases, absolutely. Not surprisingly, but it hasn't surged enormously, which is something to be very thankful for. But what we have seen is the emergence of other things. You mentioned RSV, which is respiratory syncytial virus. Been around forever, definitely not a new organism, not a new virus. Typically infects young children. Um, yeah, they're out. They feel pretty lousy for a while. Um, but the we got a huge surge of RSV in the early part of the winter. Probably because it is a disease that typically hits kids, and kids weren't at school and they weren't interacting with other kids, so they didn't get naturally exposed, and now we're playing catch up.
Okay.
Um, the current good news on that one is it looks like at least over the last week or two, and we're now as we chat, we're sort of at the end of December. It's looking like we've still got high numbers of cases, but they seem to have flattened off a little bit in terms of the rate of increase on RSV. Um, the third um, organism to talk about is influenza.
Mhm.
The restrictions during COVID definitely had a good impact on influenza cases. Again, influenza, COVID passed very similar person-to-person transmission, respiratory transmission. They're both respiratory viruses. So you put controls in to prevent the spread of one, you're going to prevent the spread of the other. And flu levels for the 2 years of the pandemic were pretty low. They bounced back big time in this year, as one would predict that they would.
Right.
So we're seeing definitely high levels of influenza with the associated hospitalizations and mortalities. Flu's a little different than COVID. The symptoms are very similar, but flu has a bigger impact on children. So we see more infant childhood morbidity and mortality from flu than we actually do with COVID. So it's
Mhm.
definitely flu is more of a child centric, and the elderly, of course, get impacted by both COVID and by flu. Again, as we sort of reflect where we are now, approaching the end of the year 2022, the flu numbers have flattened a little bit, so cautious optimism there, but they're definitely a lot higher than they have been. Lessons learned from all of this
Mhm.
is, aside from the challenges of absenteeism and temporary workers and the general move towards more automation, which is going to take a long time to implement. Um, I think one of the key messages that we've learned, which has definitely been a message that we've tried to put out from TAG, is broad advice to food entities at all levels, whether they're working on farms, manufacturing, distributing, retailing, or restaurant level. Um, when somebody calls and says, I've got flu-like symptoms, or somebody feels I've got flu-like symptoms, aches, pains, little fever, headaches, sore throat, for goodness sake, stay at home. Um, I think that's the best strategy to try to reduce the spread of these to all your coworkers. Um, as a society, we uh, typically, if you didn't feel too good, there was this sort of, I don't know, societal mental pressure. Oh, just, tough it out, go to work. Don't miss that meeting. Um, I think we've learned today to respect when somebody calls in and says, I don't feel too good. They say, well, stay home. We don't want whatever you've got, keep it. Um, the advent of video calls have made a huge difference to communications and connectivity as a result of all of that. Um, Born out of necessity as part of COVID, and we were all operating virtually. But that I think is a key lesson to remember, is that these respiratory viruses spread easily. They're transmissible, but you can reduce the likelihood of transmission if you stay home, and if you are sick, avoid contact with others, and go remember the lessons of social distancing and masking and etc. and hand washing and not touching your face, and um, those things to reduce transmission. So um, shouldn't move on and out of 2022 without mentioning monkeypox.
Oh,
Um,
right.
Monkeypox was the virus that came and went. As COVID was going away, all media outlets were focusing on the surge of monkeypox. Another virus, definitely a person to person, but rather than respiratory borne, it's spread through close contact. You get a rash with monkeypox, as I think everybody knows, and it's the little lesions that look like blisters, and that fluid in the blister is full of virus. So when you're in close physical contact with somebody who's got the monkeypox rash, then there's a very high risk that you'll pick it up from them because they're loaded with virus. So different mode of transmission. Monkeypox exploded onto the scene, and everybody got concerned about it, and we went down exactly the same road. Um, um, of anxiety, but thankfully monkeypox has largely gone away. It went up quick, it peaked, and it came down quick. So 2022 was the year of monkeypox, and hopefully we won't see that one again.
Right.
But what it's done, Lisa, is there's nobody in the country who hasn't become more aware of infectious diseases.
Right.
Um, and as a society, sadly, we love to scare each other. So when these things emerge, you start to get certain elements of our media who make a huge deal of it, scare everybody, probably unnecessarily. And as you know, I'm a huge advocate of, well, let's just tell it how it is and be pragmatic, but don't overreact.
Right.
It's particularly if you don't understand what's going on. Some of these infectious diseases sound really scary, and we get, unfortunately, politics playing a role and social media getting involved and muddling stuff up, and we end up with lack of clarity and a lot of fear, unnecessary fear, which frankly plays into other illnesses.
No.
Fear generates stress, and stress causes all sorts of other problems. And we've seen a lot of other consequences of these pandemics, on individuals not wanting to go anywhere near a hospital. So underlying chronic diseases, cardiovascular, diabetes, chronic diseases have been somewhat neglected, sadly. So we're seeing the fallout of that, um, as well as the shutdowns, which have had an impact on schools and learning, and so it goes on. So yeah, a lot of lessons came out of 2022 and before with COVID. But hopefully we will go into a phase where we've now we can be a little bit virus free for a while. But yeah, 2022 was definitely a better year than 21 when it came to some of these viral infections. So think positively.
Yeah. So in kind of discussing all that, you've given some advice, some thoughts that I would think, will carry forward into 2023.
Hmm.
But as we continue to move into the year, what other expectations might you have? Or is this kind of an area that you can't really know what to predict?
Well, you're right. You really can't know what to predict. Um, I think being aware and let's just call it, I don't want to say pandemic ready, because I'm hoping that we won't see another pandemic, which is,
Mhm.
that's just a technical term meaning you're dealing with a global outbreak of an infectious disease. Um, um, we've learned systems, I think, ensuring that communications and connectivity, and if there is a need to work remotely, that we're better positioned than we were before. Um, Everybody's now well stocked up on masks and cleaning
Right.
agents, and who knows, the next virus that we have to deal with might be one that spreads completely differently, and has, so the masks won't do you any good because it's going to spread through some other means. Who knows? Let's just hope in our world it doesn't spread through food. Um,
Right.
but so I think preparedness is key. I think and that's true of every aspect of a crisis or a situation, is that we react, we deal with it, and then as time goes on, we forget. So I think maintaining two things is continuing to maintain visibility into what's going on. And we've recognized that as important at TAG, and have created ongoing informational newsletters going out related to where we see some emerging infectious diseases and what's going on to some current infectious diseases. So from a food industry, public health is keeping track of what's going on in the background so that you are aware. Is it a big deal? Is it a little deal? Should I worry about this? What should I do? And we've made that a big part of our offerings out of TAG for the companies we work with, and a lot of that is free to anybody who wants it.
Right.
So being prepared for the next unknown, um, and maintaining that approach that if you don't feel well, stay home, um, irrespective of what it is, because if you don't feel well, it might be an infectious agent that we'd rather you didn't share with the rest of us.
Right.
So, I think that's a philosophical change that companies have made, and I would encourage them to continue down that road. I mean, there's always the titration against people who just want a day off, but hopefully that's at a minimum. And most times people call out sick, it's for the right reason. So hard to predict where 2023 will go, but um, personally, I don't see COVID coming back in a huge way in 2023. Um, that's perhaps as much wishful thinking as any knowledgeable science from a
Right.
predictive perspective. It does keep changing. So the best strategy is to watch things and be prepared.
Okay. Well, thank you, David, once again for your insights and advice and recommendations. And again, we thank the viewers for joining us today. We look forward to continuing to bring you tag team insights on current and impactful industry trends and events throughout 2023. So be sure to click subscribe to stay up to date on all things food safety and public health from TAG experts. Thank you.
Thank you.